The origin of COVID-19. The COVID-19 virus, which is a recent plague, is indeed a next mark around the globe that the origin of the coronavirus have been caught, and rumors continue to spread about the COVID-19 virus called SARS-CoV-2 that originates with the animal of bats and locusts and is said to have also emerged, however not on our global community based in Indonesia.
Coronavirus is a large family of viruses that get their name from the halo of spike protein on the outer surface which resemble a crown. The new coronavirus is called SARS-CoV-2. SARS-CoV-2 stands for Severe Acute Respiratory Syndrome Coronavirus 2. The discovery of SARS-CoV-2, there are now 7 types of coronavirus known to affect humans for regularly circulating human and mostly cause mild to moderate upper respiratory tract symptoms that most people think of as the common cold. SARS-CoV-2 causes a disease called COVID-19. COVID-19 can be deadly, particularly for older people. The virus is spread through droplets in the air after cooking or sneezing, which people nearby can take in through their nose, mouth, or eyes. The virus can also spread by touching and contaminate surface, but it's unclear how long the virus lives on surface on inside your body. The virus travels quickly to the back of your nasal passage and to the mucous membrane in the back of your throat. The virus attacks to a receptor called angiotensin converting enzyme 2 or a step on respiratory cell in your body. The virus is genetic material enters your cell. The virus then hijacks your cell to produce copies of itself which go on to infect more cells.
The majority of COVID-19 cases are mild. Some even have no symptoms. If you have symptoms, they could show up 2 to 14 days after exposure. They are most likely to be similar to a regular cold, the flu, or seasonal allergy like a fever, headache, fatigue, sore throat, and runny nose. Coughing and shortness of breath are common according to the Center for Disease Control and Prevention. The older you are, the more likely you are to experience several forms of the symptoms. Some cases have gastrointestinal symptoms such as diarrhea. In more extreme cases, and for people with underlying health conditions like heart disease or diabetes, you can develop pneumonia. Frequent or high fever, persistent cough, and signs of respiratory distress like shortness of breath and chest pain. A small percent of cases progress to acute respiratory distress, difficulty breathing, chest pain, and pressure. Confusion, extreme fatigue, persistent pain, or other severe symptoms require immediate medical attention. The result could mean shock, organ dysfunction, or heart failure. If you have severe symptoms, it's definitely time to get in touch with a healthcare provider. But with mild symptoms, it could idea to call your primary care doctor first instead of rushing to emergency room.
Next, I will explain about how coronavirus can be spread. Corona can be spread a variety of ways. First, droplet transmission. COVID-19 can spread through splash or droplets when coughing or sneezing that will be sucked by other people around him. One point of saliva can infect many people. 2. Vomit transmission. When we walk, coughing or sneezing, saliva sprays can be stick in object and then unconsciously the hands touch body parts such as nose, mouth, and eyes. 3. Close contact. Through direct contact such as shaking hands and interacting at close range. 4. Aerosol transmission. Transmission through aerosols or air. This transmission is unexpected through the air conditioner because the virus is very small. 5. Droplet and fomite transmission, large group at risk. Transmission is very easy to occur when in one place there are people gathered with much frequency, such as in public transportation or in a closed room when meeting. 6. Droplet and fomite transmission, elderly and sick at high risk. The coronavirus can also spread someone with low immunity.
Prevention of getting infected by COVID-19. Some precautions that can be done among others. First, washing hands with soap and water for 20 seconds, using an alcohol-based hand sanitizer with 60% content if water and soap are not available. Second, avoid touching the eyes, nose, and mouth area using your hands that have not been washed. Third, avoid contact with sick people. Fourth, when you are sick, use a medical mask or any mask you have. Stay at home or immediately go to a health facility, and it is advisable not to move outside. Fifth, cover mouth and nose when you are coughing or sneezing with tissue and throwing it into the trash can. The last one, perform routine disinfection of surfaces and objects that are often to touch.